And now all new at 11, a prescription for pot. It's becoming more and more common in Florida. 3 years since voters said yes to medical marijuana. In fact, Florida is the second fastest growing medical marijuana market in the country, according to Marijuana Business Daily.
Tonight, CBS 4's Karli Barnett takes a closer look at what's involved in the booming business of medical marijuana.
There's a lot more resources out there. You know, from where we started in 2016 to now is completely different with the medical marijuana program here in Florida.
Kristen Patrick is one of close to 400,000 Florida patients who has made the change from traditional medications.
I have suffered with a history of anxiety and PTSD. Using a lot of pharmaceuticals, you have really bad side effects. So for me, you know, trying medical marijuana was a great, homeopathic alternative.
She's not currently using it because she's pregnant, but Patrick is not alone. Since this past May, there's been a 50% increase in Florida medical marijuana patients. The process of getting a medical marijuana card starts with seeing a qualified physician.
I guess what you would initially think with medical marijuana, there's just a bunch of young kids coming in with either fake issues or no issues, just wanting to get high, but surprisingly, that's not it.
Dr. Anthony Andrioni with Cannabis Doctors of Florida admits, as a former surgeon, he was skeptical, but he came around after he saw what he says are the positive effects of medical marijuana in patients.
Patients off of opioids, or at least reduced significantly, would be more than 75% of the patients I've seen.
He's one of about 760 qualified physicians between Broward and Miami-Dade counties. The requirement, a 2-hour online course from the Florida Department of Health. But Dr. Andrioni says potential patients need to come to their initial appointment prepared with documentation.
Whether it's MRI for chronic pain, an arthritis, or a herniated disc, or PTSD, if they have some sort of traumatic episode in the past, did they have behavior therapy, were they on antidepressants or some sort of medication?
Some of the other 12 qualifying conditions include cancer, ALS, epilepsy, and any condition a doctor deems of the same kind or class, which can include diagnoses like depression and anxiety. If a physician recommends you for medical marijuana, you're put into a registry to receive your card. There is a $75 fee.
When I initially became a patient, it was in 3 months actually is what it took me to actually obtain a card and be able to get into dispensaries, and medicine was limited at that time. And now, 5 to 10 days, patients are able to access dispensaries.
Michael Puentes opened Miami Aid Wellness, a cannabis clinic. He says the steady increase in Florida patients is likely due to this more streamlined process and the legalization of smokable medical marijuana back in March.
In general, the industry is growing exponentially, and Florida's poised to be one of the biggest markets in the country.
Vineet Patel is the regional operations manager of Curaleaf, one of more than 170 dispensaries in South Florida. This is where you would take your card to receive medical marijuana.
Hi, thank you for stopping by. Can I see your card, please?
Yes, they even have a drive-through.
I'm actually a licensed pharmacist here in Florida, so I've seen the other side of this.
People can use medical marijuana in several forms: oral, topical, under the tongue, smokable, or inhalation.
Our most popular product would definitely be our vape cartridges and our flower.
For those eligible, medical marijuana may be something that works for you, but a doctor can help you learn more.
And there's so many other patients out there that I think could really benefit from medicinal marijuana that are maybe afraid to talk about it and shouldn't be.
In order to find a qualified physician close to you or a dispensary, we have the information from the Florida Department of Health on our website, cbsmiami.com. Karli Barnett, CBS 4 News.